In this morning's Health Watch, as the popularity for weight loss drugs like Ozempic grows, so do concerns about its misuse.
Poison Control Center calls related to the drugs have increased by nearly 1,500% through November of this year. And we are joined right now by Dr. Angela Tran, an internal medicine and obesity medicine expert. Doctor, thanks so much for joining us today.
Thank you for having me.
Yeah, thank you for being here. Such an important topic. Yes. So, first of all, explain to us what this drug is, semaglutides. What is that drug all about?
Yeah, so semaglutide is a generic term for an injection medication called Ozempic. That's actually FDA approved for the treatment of diabetes, but it gained popularity because it can actually help with significant weight loss. Now, not all insurances cover it, so patients are actually looking for inexpensive alternatives, but the problem is these are not the same formula, which is raising concerns for harm and potential overdosing.
Yeah, so why is that overdosing happening?
Yeah, so, semaglutide is actually coming from compounded pharmacies, and they come in vials in syringes as opposed to Ozempic, which is a pre-filled pen. Without the proper education, these patients are self-administering at home, which leaves rooms for dangerous errors in dosing, which is leading to an alarming increase in the calls to poison control, number of visits to the ER, and really can put you in a life-threatening condition.
Yeah, and along with that, what are the signs of that? What does an overdose or a poisoning of this drug look like?
Sure, yeah, these medications are not easy, so they can cause nausea, vomiting, stomach upset, gastrointestinal issues, and in severe cases can affect your gallbladder and pancreas. The most important symptom is patients can develop vomiting that can't stop. And the problem is this can lead to dehydration and quickly can potentially put you into kidney failure. So it's so important to seek help urgently because it is very time sensitive when it comes to the care of these medication side effects.
So what advice do you have for those taking the medicine or those interested in possibly taking it?
Sure. As a medical weight loss doctor, it is so important to work with a medical provider and team that just has experience with a medication, can help you navigate and monitor you, and just have open lines of communication, especially when you have concerns that arise. For the most part, these medications actually can be life-saving. It's just important to work with the right team and complement it with the right diet and exercise program.
Yeah, and in terms of how these drugs are being obtained, doctor, how is it being obtained and how is it being misused? Is it found on the streets or what?
You know what? Unfortunately, you can walk to just any place that is distributing from these compounding pharmacies. I always strongly encourage patients to work with an actual medical provider to write a prescription that you go to a commercial pharmacy. Those are FDA regulated, they have more safety to it, and like I said, it's all encompassed in a holistic approach of care, not just taking a medication for your health.
Wow. Well, thank you, doctor, for enlightening us on this. This is
Sure,
very
thank
concerning.
you.
Yeah, thank you. You can watch this interview and all of our health interviews, of course, on our website, cbscolorado.com. We'll be right back.